Hello, everyone, and thank you for tuning in to the HPHR Journal Insights podcast. HPHR Journal is an independent academic referred journal that seeks to improve health equity and social justice through the publication of content grounded in the thoughtful evaluation of evidence. It is published by the Boston Congress of Public Health, a nonprofit organization that addresses social change at the nexus of public health equity, and social justice. This podcast delves into articles published in HPHR Journal that addresses complex public health issues in an effort to affect social change. My name is Riva Bajuri, and I will be your host. Today, I'm joined by Jerica Davis and Christy Altador, co-authors of Ensuring Health Equity for Adolescent Sexual Health Education. Their article can be found in HPHR Journal edition 46 on sexual and reproductive health, available on hphr.org. To start off, please introduce yourself, your professional background, and the content of your research.
Hi, I'll go ahead and get us started if that's okay. Uh, my name's Christy Altador. My pronouns are she, her, and I serve as the Director for Adolescent Sexual Health at the National Coalition of STD Directors. A little bit about my background. I've worked in local STD and HIV prevention in Florida, where we did work as disease intervention specialists at the health departments. We did STD treatment and testing, education, and linking patients to services. A couple of years ago, I shifted my focus to young people specifically. And since joining NCSD, I continue to support our organization in providing subject matter expertise in jurisdictions that we serve and providing technical assistance to reduce the spread of STDs.
Great, thank you so much. Jerica, would you like to introduce yourself as well?
Sure. Thank you for having us. So, my name is Jerica Davis. My pronouns are she, her. And I am the Senior Manager Adolescent Health at National Coalition of STD Directors. And so, my background is primarily in working directly with youth. So, prior to this, I was working with teen girls in grades 6 through 12, facilitating programs in schools that taught sexual health, career readiness, life skills, things of that sort. And that was girls living in underserved areas in the DMV area. I do live in Maryland. And so Christy and I work very closely together at NCSD to really elevate and highlight work around adolescent health and adolescent sexual health. And so even outside of my work with Christy and with NCSD, I continue to support organizations that provide these similar services to young people.
Awesome, thank you so much, and it's such a pleasure to meet with both of you. My next question is kind of why did you both choose this research topic?
Great. I think I'll take the first part of this question. Jerica, feel free to add in. So, collectively, we both support state health and education leaders implement state-specific action plans that address adolescent sexual health policies and practices in their state. And we follow the CDC, Centers for Disease Control and Prevention. We follow the Division of Adolescent and School Health. They have a three-tiered approach that's to address school-based HIV and STD prevention. And so that's the core of our work. And so with that and exploring some of the different areas around like how you can provide services to adolescents around sexual health, we realize that there is a large body of evidence that supports quality and comprehensive sexual health education and how it really helps young people and equips them with information and skills that they'll need to make healthy decisions. But then we also saw that there are disparities that lie in the delivery of how um, that education is equitable and inclusive, especially to marginalized youth. So we felt with our work with both the health and education sector that we knew it was important to specifically highlight how health equity impacts sexual health learning and how it in turns, you know, gives good outcomes to young people.
Yeah. And we also, even outside of that, we know that I think as people in general, but particularly young people, if they don't feel like material that they're learning is relevant to them and that they can see themselves in it, it's not really going to stick, and they're not going to it's not going to have the benefit and the effect that we want it to have. And so a lot of marginalized youth, they don't see themselves in the material being presented because it's not written for them. And so it's super important to make sure that curriculums are equitable and when teaching sex ed, so that all young people, marginalized young people especially, can see themselves in the material, they can relate to it, and then they actually feel empowered to make healthy decisions for themselves.
Great, thank you. And you kind of touched on my next question, which is kind of what did you find in your literature review and what was surprising about that?
Yeah. So, like I mentioned earlier, we work in a cooperative agreement with the CDC Division of Adolescent School Health, or otherwise known as DASH. And we work with other organizations in facilitating and providing technical assistance, capacity building, and training. So our work is truly anchored in that three-tiered approach. And the three-tiered approach in that overview is essentially um, when schools implement delivering sexual health education, increasing access to sexual health services, and promoting safe and supportive environments, young people have better outcomes, especially in terms of their sexual health. So we really wanted to highlight that in our research. We also highlighted some work from some of the partners that we do work with in this space and arena, one being SECUS, and they stand for Sex Ed for Social Change. They're really dedicated in this work with us. And so their Sex Ed state legislative mid-year report that we highlighted quite frequently in the publication really shared how state legislation influences policy efforts around this work and breaks down some of the bills that were introduced in early 2021 that relates to this. Um, yeah, so it was just really important that we looked into some of the work that folks have already been doing on the ground and tying that into some research. And I mean, we found quite a few surprises, I'd say.
Do you have any examples of the surprises?
Yeah, I think the biggest one, and this, I think we've seen it even outside of like literature for writing the article, but sexual health education in general is widely supported by parents, um, definitely by teachers and young people. But I think if you look at a few organizations that have done some research and some studies on these things, you'll find that majority of parents they would like their children to participate in sexual health education. And as long as schools are transparent about what their students are learning, they're okay with it. So that's the first thing. But then other surprising things we found were that there's a ton of variability around the country around A, if sex ed is even required, and then B, if it is, what should be included. So states have their own laws and policies around that. Districts have their own individual laws and policies around that. So there's a lot of variability, and we include some of these numbers in our article. And then lastly, there's surprising data that has come out since COVID. So, for example, the CDC did adolescent behaviors and experiences survey, which is like a snapshot of how young people were doing during COVID. It was done in 2021, I believe. And so, for example, one of the things that survey showed is that students that experience racism in school also experience poor mental health outcomes, right? And so, among other things, we know that poor mental health outcomes is connected with sexual health outcomes, increased risk of risky sexual behaviors, and things like that. So there's a lot of surprising things that we found. There's also some things that kind of confirm what we already knew. Also want to mention that when students engage in inclusive, comprehensive sexual health education, the benefits spread to the broader school community. So I think a surprising thing to us and to a lot of people is that even those students that aren't engaged in comprehensive sex ed, they still get the benefits, even if they aren't engaged, if you do offer that education in your school.
Great, thank you. And I was just wondering if you could kind of clarify quickly what exactly is sexual health education and why it is so important for young students to have.
Yeah, so the way that we define sexual health education is it's evidence-based and health equity-based curriculum and learning. And comprehensive sex ed really provides youth with information, valuable skills, and motivation to help them make healthy decisions, not only for themselves, but around sex and sexuality. And sex ed doesn't have to only anchor to testing and disease prevention. It can cover a variety of different topics, right? So that might look like looking at relationships, both romantic and platonic, personal skills, consent, value, society, culture, and just general human development. Um, so I think that based off of like some of the narratives that folks are just reading or thinking when it comes to sex ed, they're looking at it as simply, oh, you just provide the person with a condom and say don't have sex, and this is, you're gonna have these STIs, and that's just where it stops. But really we're finding that sexual health education is holistic and it covers these various areas, and it improves other outcomes not only related to sexual health.
Great. Thank you so much for that definition. My next question is, what are some ways in which we can apply a health equity perspective to sexual health education?
Sure. So, depending on your role in the work, the strategies that you use can vary. So, for example, educators and health and providers of sexual health services, they can do things like utilize inclusive language, encourage sex positivity, reduce stigma in their spaces, offer resources that are relatable to the young people that they're working with, and then involve youth in actually developing the curriculum, like allow them to include their voice. And those are all great ways to apply a health equity lens. Um, but it's also important that facilitators stay up to date on training, different strategies that may come up, learning just about the ever changing dynamics of health equity. Always being open to learning. So, and then finally, another key strategy is continuing to advocate for inclusive sex ed for all youth at the state and the local levels through, if allowed, through your position, through policy actions, with school boards, PTA gatherings, with parent groups, community partners, and things like that. But if you can't go as far as the policy, just continuing to educate, um, and being an advocate in that way about the importance of comprehensive sex ed and the importance of making sure that it's equitable. And then, even at a more individual than that, tapping into your own experiences, if appropriate, and utilizing that in your curriculum, but remembering to center the experiences of the youth that you're working with that come from those marginalized communities, and remembering to include their voice and their experiences in your curriculum.
Of course, thank you so much. And kind of going more into depth with the implementation of equitable sexual health education, I was just wondering how institutional biases may affect the quality and effectiveness of this.
Yeah, so from what we know around sexual health education, generally it depends on how a state mandates its delivery, right? So that's looking at medical accuracy and if it's age and culturally appropriate. So for the states that do require sexual health education, it's important that we explore how policies at the state education level, how that impacts curriculum development for local education agencies and districts, right? So we're looking at systemic biases, right? And how that impacts how sexual health education is delivered. Um, at the school districts and at the school level. So what we're seeing is strong mobilization efforts to fight through misinformation and disinformation that's been tossed around and being spoken about in the media around sexual health education. One thing that we can share is there's a collective, a collaborative called the Future of Sex Education Initiative. And what they do is it's a group of national partners, and they developed the National Sex Education Standards. Really, it's a guide, and we work with a ton of partners that provide, subject matter expertise and input into this work. And so what it is a guide to help folks that are in decision-making seats around, you know, quality and making sure that it's effective and that it's safe and it's accurate. So what they do is they provide straightforward guidance on the essential minimum core content that's required and needed for sex education. And they also underline like making sure that's age appropriate for students in grades K through 12 and that it's effective for all states. So relying on guides like that and getting involved in groups like the Future of Sex Education Initiative, that is super helpful in combating some of the systemic biases that impact the delivery of sex ed in states. And continue to work with partners that really focus on this work, right? Like CICUS and Advocates for Youth. It helps create national conversations around quality sex ed and how to continue to reduce and eliminate some of those biases. So it's definitely something to consider and keep in mind for folks. And we know that it varies from state to state depending on the mandates, but there are definitely resources and spaces out there to help folks take a look at maybe how the quality of their sex ed is being delivered and developed.
Of course, thank you. And my next question is kind of focused on exploring the role of what racism and discrimination play in determining health to begin with, and why we need to be mindful of that in order to deliver quality and effective sexual health education.
Yeah, so we know that chronic racism and discrimination, these things are systemic, right? And we know that the negative impact that they have on people in communities of color, that's been felt for centuries, and it's going to continue to be felt, right? And so um, the disparities that they cause in like social determinants of health, that affects that drives poor health outcomes in communities of color. But even outside of that, and specific to health, chronic racism and discrimination affects the healthcare that BIPOC individuals, Black Indigenous people of color, that they receive. Right. So, for example, this includes access to quality care, mistrust of medical professionals due to historical things that have taken place, healthcare bias, a number of things that come into play when it comes to accessing quality care for people of color. And I think a really good example of this that really just pinpoints the effect of chronic racism and discrimination, and without really any other factors, is maternal mortality, right? So we know that in the United States, a woman of color can be highly educated. She can be very well off financially. She can live in an affluent neighborhood. And she is still 4 to 5 times more likely to die during childbirth than a white woman, right? So chronic racism, discrimination plays such a huge role in the healthcare that individuals of color are able to receive in so many different ways. In so many different ways, and there's just so many levels to how that impacts health outcomes and quality of life.
How can we utilize an equity-focused curriculum to kind of rectify the health effects of chronic racism and discrimination like you just described?
Sorry, Christy. I think so. I struggled a little bit with rectify, only because like I said, we know like chronic racism and discrimination are systemic. And so I feel like to truly rectify those effects, we have to, we get into conversations about dismantling those systems. So like it's a whole other conversation. But health and equity focused curriculum, what it does is it can acknowledge to marginalized youth that, hey, you experience this and this is the effect that it has on you. And I am speaking directly to you when I'm presenting this material. So it gives them a space to feel validated in their experience and to feel empowered to continue to make healthy decisions for themselves, despite what their despite what their community looks like or despite what resources are available to them.
Of course, definitely. Thank you. My next question is kind of what strategies can we employ in order to develop, revise, and teach equity-focused sexual health education?
Yeah, I'll hop in here and like even tag this can kind of tie into what Jerica just mentioned, but I think that it's important that folks that are in positions of power and making decisions around how this is being delivered, that they just continue having conversations and bringing this issue up in meetings and in spaces that can continue to facilitate change. Um, I know that a ton of times folks are just nervous or scared. They don't want to ruffle feathers or, say the wrong thing. But I think it's important that, you know, people are champions and saying that it is imperative that we have equity focused curriculum and that it's important that we continue to teach it and revise it, stay current with what's going on, um, and continue learning. So that can be done by like joining national partnerships and dialogues around this work, right? And connecting with folks to develop best practices and inclusive strategies. It might mean referring to resources that come out like the National Sex Ed Standards that really help with grounding curriculum in social justice and health equity. We find that it's really, really, really important to, and we'll continue to say this, to engage youth and parents in the development and revising this curriculum. You know, nothing without us, nothing for us without us. Jericho always says that, and I think it's just really important that that's employed in creating this curriculum. It's important that there's efficient training for educators and facilitators to deliver the curriculum and the lessons appropriately. Um, it's important to like lean on lived experiences as well when looking for facilitators or programs that offer this training. Oh no. And just lastly, learn and connect with other states that are doing this successfully.
I'm not sure what happened, but for the sake of movement, we can start discussing the next question.
Yeah.
Um, so describe.
So I guess we
Oh,
can, yeah, we can chat about how our research relates to achieving social justice and health equity.
yeah. Do you want to start?
You can go ahead.
Okay. So essentially, sexual health as a whole intersects with a bunch of other health outcomes. Like I mentioned earlier, it intersects with um, mental health outcomes. So mental health, reproductive health, maternal health, all those things intersect with sexual health. And so our work to support partners at both state and local jurisdictions empowers young people to access this comprehensive and equitable sexual health education and services, and also empowers them to know and utilize their rights to access to inclusive care from both educators and providers. And so we know that doing this work also lends into social justice and racial justice and health equity arenas. And I would also throw in that when we empower youth to know these things and to seek out these things, and we provide them with these tools and these skills, and we encourage them to use their voice and we allow them to use their voice in spaces, we are creating a generation of folks who will take these skills into adulthood. So these are the people that when these are folks that are going to grow up and get older, and they are going to be running our health departments in our schools, and programs, organizations, and they will be well equipped to do so because we took the time to empower them when they were young.
Hello, I
Absolutely.
actually am just jumping in here again. I had some technical difficulties. Do you guys mind kind of catching me up on what you guys have been talking about?
No worries. We just talked about how our research relates to social justice and health equity.
Okay, great. Christy, were you about to jump in there?
Yeah, I was just gonna make a final call to action and just tying all everything that we just shared um, into a nice bow by just saying like it's just important. All we could say to our audience and to folks that are interested in this work or would like to know more or are already engaged, just continue to support inclusive, equitable, comprehensive sex ed. It's important that folks are vocal about its benefits and to share, share information with friends, colleagues, internal staff on ways to provide, how we can provide quality sexual health education through a health equity lens. It's important that folks stay curious and continue learning about the experiences of marginalized youth and young people, some of the challenges that they face, and some of their needs that they might have. And that might include, like we said before, soliciting and listening to their voice and incorporating their voices into the work that's being done. And then, of course, at an individual level, just becoming aware of, your own biases that you have and how they might find their way into the curriculum that's being delivered and actively working on preventing that.
Great, thank you so much. On that note, I think that concludes all the questions I had for the both of you. And I was just wondering if either of you had any last comments before we wrap up.
Thank you again for having us and highlighting our work here. We continue to support folks that work in sex ed and work to deliver sex ed. So feel free. Our contact information will be shared to reach out to us, and we'll be happy to continue having conversations with you.
Yep. Everything that Christy said. Thanks for having us. We're super excited to talk to you today, and we're really passionate about doing this work. So thank you.
Awesome. Thank you so much. It was such a pleasure.